Chorus Voices, the podcast brought to you by Chorus, a fresh approach to community service. Settle in, listen in, and enjoy the voices who bring you reflections, musings, and stories from our community.
Hello and welcome to this episode of Chorus Voices. I'm CEO Dan Minchin.
And I'm Head of Brand and People, Lou Forster.
So Lou, this podcast is recorded from our respective bunkers.
Yeah, a slightly unusual setup this time.
You know, it's almost impossible. In fact, it is impossible to talk about anything much at the moment. It's April 2020. Talk about anything other than how life has been affected by the COVID-19 outbreak. And so we're recording this from different locations, connected by video and recording separate soundtracks. So hopefully it all kind of comes together and works okay for the listener.
And it only took us about 10 minutes to get set up with the equipment, so we're doing pretty well.
Took a few goes. It's sort of symbolic in a way of the way we've tried to respond to the whole situation at Chorus, and 1,200 people in the Chorus team have responded and adapted, and even our customers themselves who are adapting, obviously, to an extremely challenging set of circumstances. So really, the least we could do was try and find a way to record the podcast virtually.
Yeah, exactly. And there's that adage about, if you really need to make something happen, you can. Sometimes we avoid it because it's difficult, but we said we're going to do this separately, and we found a way.
Yeah, and that's really been the whole kind of theme for us at Chorus. It's been very challenging, and I think a lot of people have found it really difficult, and ourselves included, and we might talk a little bit later about the challenges we've personally faced. But I think our mantra right from the start has been, how might we adapt the way we work to continue to meet customer needs at the same time as keeping ourselves and each other safe and well. And that's been a bit of a mantra. And so I think we figure that today's podcast episode should be around Chorus in the COVID-19 world, and how we've adapted and what we've tried to do to carry on meeting needs.
How we have responded collectively really says an awful lot about Chorus and our community. It's been pretty interesting to be involved in it and also to observe us from afar.
And as you said before, it's amazing what you can do if you really have to, and that's been something that we've managed to do in some areas. So we were just going to talk about a few of those examples, and the place we thought we might start, Lou, was to ask you to tell us all about some of the changes that happened in the disability support work that we do in the NDIS program.
Yeah, I thought this was interesting because go back 6 months and we didn't have a clear leader in this space. We had lots of team leaders, but we, relatively recently appointed someone to kind of lead this area, and that has proved perfectly well timed when we've had something to deal with like this. So we've got a fantastic leader called Claire who works in this space and has been doing some amazing work. So getting on top of helping at-risk customers get the provisions they need to stay home and stay well. So this shop by list approach to get some shopping that's pretty hard to get at the moment, as we've all found. Also keeping people informed. There's so many changes to the way that people with disability have usually been supported. Suddenly, it's spun on its head, and people need to understand what's going on, what the updates are, and how can they find out. So we've been really...
And some of these people are sort of particularly vulnerable, I guess, in this sort of situation, given the way they live and then where they live and who they live with. And often the work we've been doing has been out of the house and helping them get out and do things, simple things like shopping, and the whole all of those usual ways of operating have just had to change.
And if you are someone that needs, physical support, then you're more likely to be at risk of, potential infection as well, because you actually need someone, in your life physically supporting you. So it really,
a shower or getting dressed and that sort of thing. Yeah,
takes the whole isolation to a different level then.
It sure does, and and along with finding a way to get some of those practical things to happen, we've continued to have support workers go in and provide those support, in physical contact with people. So we haven't been able to, because of the nature of it, the essential nature of our services, we haven't been able to just shut things down. We've had to find a way, which has put a lot of pressure on us to support people to wear the right protective equipment, know how to use it, how to access it, and all of our listeners will be familiar with the challenges there are in getting supplies of those sorts of things. So just those most basic things which we took for granted have been put under pressure.
Definitely. And I think the one thing that has stood us well is our dabbling with technology. And so we had a few pilots that have been going on for a while using different pieces of technology. But that's been one of the things that has kept us in touch with people. If we can't see people face to face, obviously we have the phone. But we've got a couple of groups that have been using iPads and video chats, and suddenly that is really key.
Yeah, well, let's talk about those groups for a minute, because I guess the way we were working up until about 6 weeks ago was those people would come together, form a group, and do things physically together on a bus or in one of our centres. And that was actually one of the first things where customers themselves were saying, well, look, I don't actually feel safe going into that environment, and staff, of course, were saying the same thing. So here's the question: how do you continue to meet the group social need that people have got? In a way where you're not physically in touch.
Yeah, and you said about the timing there. I think the timing of how we responded is very interesting, because we had decided, or the teams themselves with customers decided to change the way we were delivering those services before we had the mandate from the government that things like groups, social centres needed to close, which I think it's just quite interesting to reflect on. Yeah,
there just sort of wasn't really a right answer in those sort of circumstances. So from a sort of leadership perspective, right across the organisation, different people, different leaders across Chorus were trying to find a way to navigate their way through. And so what we did was we did close the physical centres, but there's 50 or 60 odd staff who therefore were available. And one thing we didn't want to do and didn't need to do was stand people down, which is what a lot of other organisations have done. We said, how might we redeploy those people? And the sorts of ideas that have popped up include creating a sort of and delivering essential bags, toilet paper, puzzles, COVID information. We've established a mobile library. As you said earlier, we've set up groups and conversations and social networks through virtual means, Skype, iPads, that sort of thing, and even dropping by people's houses and visiting them from a physically safe distance out the front, in the front garden, on the porch, in the driveway. And then, the most basic of all was just having a really good, reliable list of contact details, so we could just build the network of social contact, even if it was just by phone, as a way of just checking in on people on a regular basis. And so Chorus staff and volunteers have got involved in just adapting the way they were working to try and keep meeting that need for people to stay connected, because we're all really aware of how important that is, even when we're physically apart.
I think we've become hyper aware of that, all of us, in the last few weeks. We suddenly realise we really need to have human connection, otherwise we go a little bit stir crazy.
And ironically, almost in some places within Chorus, and I know this is true across the world, people have become better at staying connected. More authentic conversations, checking in on people and asking the sorts of questions which you might not have occurred to you to ask just 4 or 5 weeks
ago. It does feel safer and more comfortable to ask, how are you? How are you really? There's been a lot of those kind of questions bandied about, a bit like the "Are you okay?" campaign. Actually just listening.
Make sure you listen to the answer.
Yes, yeah. It's funny you were saying about the different ways we've adapted with the groups. I was at our Chorus kitchen this morning, and 10 of our colleagues who were in centres are now working in and around the Chorus kitchens. That's a great example. I kind of walked in and said, Robbie, you're here.
Because the demand for meals and food has gone through the roof for us and across the world. That lack of food security that people are facing is something that we're able to respond to through our kitchen. As you say, that used to operate at a certain volume, 1,000, 1,200 meals a week or something, and we're looking at doubling that and potentially even further. And as you said, what we are now able to do is redeploy people into other kinds of work, which has required those people to adapt to different kind of work. It's required the kitchen to accommodate those people who might not have been as familiar with the way of working. And of course, the customer at the end of the delivery is in pretty urgent need of these things.
And it made me think of a couple of conversations we've had, as leaders across Chorus about not going back to normal, but creating a new normal. And talking to Rhonda at the kitchen this morning, she said, it's been fascinating to see how we work in the kitchen. I didn't realise the kinds of work we did or how complex it was. And so, that ability to give people the opportunity to learn new skills and to, just share their skills and talents. I don't think we ever want to go back to that, the old way now.
No, that's right. There's a real appetite across the whole organisation to not go back. One of the groups of people that we spend a lot of time working with is people on their mental health recovery. And that's been another area where we've had to adapt to sort of meet that need in a way which was safe. Why don't you tell us a little bit about what we've been doing there?
Well, I think the teams look to move online quite soon, so using Skype calls and video calls. And I know that our colleague Jerry down in Bunbury has said that with some relationships with customers, actually that suddenly works so much better for them. And of course, in the long run, we don't want to have people too physically isolated, but whilst we're in this environment, some people, their relationships have flourished by having perhaps just that bit more space to be able to have a conversation, maybe without the anxiety of being physically next to someone.
Physically there, yeah.
And we've had some interesting collaborative discussions with people like the organisations like the Public Trustee and other case managers to make sure that we're working to support people in our community. And I really like this approach because it's not about Chorus and Chorus customers. We talk about not owning anybody or having that possession. So it's really about drop all the barriers, work together, share information, and what can we all do together to help customers or people in our community that just need support, whatever that support is.
Yeah, that's right. I mean, if people need money, then we find a way to give them access to money, which is the public trustee relationship. If people need medication, for example, then we can facilitate that. If people need shopping, 6 weeks ago, one of the activities we would support people with would be getting out of the house and doing the shopping with them. Well, they're not coming out of the house, and many people are choosing not to or have been sort of guided not to by the government policy. So we've still got to meet that need. And it's really required Chorus people to adapt and think differently, use technology, troubleshoot and build connections across the whole sort of ecosystem, if you like. Which is a really
and the
really positive
different way of work. Yeah, there's a different way of working and just acting. I think some of us take for granted the technology we use and things like always using cards or internet banking or whatever it is. But now to purchase from Coles and Woolies, you really need to pay for that online, and some people we support don't do that. Live with cash. So that's an interesting adaptation, and for us to support someone to get there. Another thing that we're kind of still in the creation phase, but working with our mental health colleagues around supporting each other. So, a number of colleagues who are skilled in helping people on that mental health recovery journey and supporting them day to day. And we're all finding that, our own mental health is probably slightly up and down. So we're investigating ways for our colleagues to support peers so that we all stay mentally well through this, which I think is fantastic, again, adaptation. Yeah,
and it's a real sort of, as you said earlier, throwing off of the barriers or the roles or the old silos. So I'm now not thinking of myself as an employee. I'm thinking myself as a person with a range of skills, and they may be used in many different ways. And of course, as an organisation, we need to stay as well as we can physically and mentally through this whole thing in order to provide the support we need to provide to people in the community. So it's a really sort of holistic, authentic way of working, which really has led me to reflect on what this means for Chorus and our longer term vision. And the committed listener would have heard us talk about our fresh approach to community service in the past, which is a real emphasis on putting the community back into community service in a world where community services have sort of become stripped down, bare, transactional, and almost sort of market driven. We believe that it's going to be better for people, more authentic and more effective if we can consider those services in the network of relationships that exist for people. So people live in a neighbourhood. There are resources, connections and supports in that neighbourhood, and we just are one small part of it. So there's a big piece of work going on with the chorus at the moment about what does this fresh approach actually look like and how might we make that work. I've just completed a blog which has been posted today on our website, and people can go and have a read of it. But what's really struck me is the fresh approach, which is relational, it's community oriented, and it's working through partnerships, is exactly what's come to life. It's
really
not quite spontaneous, but it's sort of tapping back into our natural human instinct to cooperate in this really, really challenging time. So the fresh approach was there. It was possibly a little bit hidden under our busy lives, and it's sort of come to the fore. It took a hell of a crisis to bring it to the fore, but it's happening. It's just been extraordinary.
It has, and it makes me think about how we lead our lives and how disconnected we can get. It takes a bit of a jolt to the system. Individually, one of us gets ill or something, but this is a societal kind of jolt that has made us realise that we are connected if we look about ourselves and we don't just drive our cars into our garages and walk into our houses. I think it's been really a wake-up call for a lot of people, and it's as tragic as the situation is, I think there's going to be some very wonderful things that come out of it.
Many of the examples we've talked about today really are examples of that fresh approach coming to life. But I wouldn't want people to think that we were patting ourselves on the back. I mean, it's been extraordinarily difficult. There are a lot of people feeling pain, fear. There really have been kind of waves of anxiety that have swept through Chorus, just as there have been in the wider community. So all of that adaptation has come at a real cost at the same time. And it causes me from time to time to reflect on how I'm going, and interested in how you're going, Lou, with working from home and dealing with the sort of the stress and the uncertainty of the whole situation.
Yeah, well, when you were talking about the adaptation, I had this visual image of we're kind of adapting whilst we're running down the hill, kind of grabbing the computer monitor as we're running out the door and heading home. Everything we can find. Yeah, so
and you don't know whether what you're picking up is going to be helpful or a hindrance, but you sort of grab it anyway just in case.
But I mean, there's benefits to that kind of way of working as well. But it has felt like moving and doing whilst you're adapting, which has been fascinating. And sometimes it's not until the end of the day that you stop and reflect and you think, how am I doing? Mm. And I think for me, I'm an incredibly sociable person, and I'm an extrovert, and I get energy from other people. So I have found it really difficult to be in a office at home. My daughter's been at home with me for a few weeks now, but she deserted me in the office because apparently I was annoying, and she's moved to a different part of the house, so that has its own challenges. So yeah, it's been hard, and even though I've tapped into a number of groups through virtual means, it's just not quite the same. It's I've felt quite starved of physical human contact. Mm. And I don't live alone, and many of our colleagues live alone, so that's a completely different situation.
Yeah, that's
for
right.
them.
And we're trying to sort of make contact and find ways to link, but it is very, very challenging. For me, I have found working predominantly from home or entirely from home to be pretty good. It's actually worked well for me, and which is interesting because I would have described myself as an extrovert as well. Have a reasonably busy family with 3 teenagers and my wife and a dog who sort of seems to want to bark at every noise that goes past, which is something I've learned. He's obviously doing that all by himself in the house all day, every day. And so that's worked okay. I do recall the first few weeks of this when the fear was building in the community and the government reaction was coming thick and fast. Every day or two, the policy was changing. I found that very difficult and draining, and I don't do this often, but I was waking in the night or first thing in the morning. It was the first thing on my mind. So I think surrounding myself, and at that time we were still working physically in meetings and in offices, and so having a team of people who could help us reflect and maintain perspective and all the things that all the experts are telling us we need to do through periods of fear was really, really powerful for me. And it does make me think about people who are not as well supported and don't have a team around them. It's been challenging. I think the not having an end in sight is really difficult as well. And I mean, I think government are now starting to talk about possibly being, X months or X period, but it's all speculation. And I think it'd be very interesting to see how upbeat we're all feeling if we're still in the same position in another month or so.
Yeah, I think that's a really good point about the knowing thing, Dan, because I think for a number of people, anxiety can be particularly prevalent with the unknown or unknowable. When you know something, you can perhaps use strategies to manage how you deal with things, but it's the unknown is just a very kind of floating. So and for some people, that's really, really tricky.
Yeah, it's quite unsettling. I mean, I ultimately feel very fortunate with the support and the connections and the resources that I have available to me, and I can't begin to truly understand how some Chorus customers and even some Chorus staff and volunteers are feeling and living at the moment. It gives me a little bit of an insight to reflect on how I'm actually going. But it's about, in the way we respond as an organisation, it's about trying to build that empathy as best we can, and just respond to that, because ultimately that's the only thing that really matters. Stay safe and well, and meet that need as it presents itself, and everything else is of secondary consideration.
Wholeheartedly agree. And I think in conversations across Chorus, we keep hearing people, stay safe and well, and people mean it. It's not just a tagline.
They do.
So I've felt very kind of cared for. It's been great.
So anyway, who knows where we'll be in another month when we record the next one of these. But in the meantime, Lou, stay safe and well.
You too, Dan.
Thank you. Bye.
Thanks. Bye.
Thanks for listening to Chorus Voices, the podcast brought to you by Chorus. If you like our show and wanted to know more, check out our website at chorus.org.au. And please leave a review. We'd love to hear your feedback, and it helps others find us and enjoy the podcast as well. Join us next time for more inspiring stories and news from our community. Chorus, a fresh approach to community service.